The CDC is standing by its guidance that fully vaccinated people can still go without masks in most situations. The agency made the reassertion yesterday. Last week, the World Health Organization recommended everyone continue to wear masks in indoor public spaces to slow the quickly spreading Delta variant. That strain was first detected in India and has now been found in all 50 states. So let us bring in Dr. Ron Elfenbein to talk more about this. He is the medical director and owner of First Call Medical Center. Thanks for joining us. So CDC Director Dr. Rochelle Walensky also suggested that mask policies in the U.S. be made at the local level. And I certainly notice as I kind of move around, some places I go, I see almost everyone masked up. Some places it's sort of 50-50, and other places it's a complete free-for-all. And people generally are trying to abide by the desires of, whoever's in charge of said place, whether it's, a city place or it's a private store or whatever. What's your take on this masking debate? If you're fully vaccinated, you're going to an indoor public place, should you put your mask on or not?
I think that the World Health Organization was wise to suggest what they did, continue to suggest what they've been suggesting all along, is that you wear a mask. Now, the CDC has said that the World Health Organization represents the entire world. So they're coming at it from a global perspective, whereas the Centers for Disease Control is coming at it from just the United States perspective. So they're two kind of different, coming at it from two different points of view, if you will. And I think that they're both correct. The CDC was wise to say that really the local populace should determine that. The CDC just makes recommendations, and they recommended that people, if you've been vaccinated, as you said, Anne-Marie, you don't necessarily need to wear a mask, but that they left it up to the wisdom of the local authorities, and I think that is the right thing to do. The problem becomes, as you suggested, is you're in New York City and then you travel to somewhere else, and you're wearing your mask, you don't wear your mask, everybody's different. But remember that each area has different rates of vaccination, different rates of infection, and things like that. I would suggest that I think wearing a mask is always a good idea. I think it's smart and it makes sense. If people choose not to, that's totally fine if they've been vaccinated. I would, in an indoor setting and with large gatherings of people, I would still recommend people wear masks. I think that's just a wise thing to do. Because remember, just because you've been vaccinated does not mean you cannot catch and not spread COVID-19. So that's a really important point that people need to understand, that just because you got the vaccine, you still can get infected with this virus.
Yeah, I think it's a great point. I, for one, just sort of always keep my mask around. And even right now, when I'm going sort of inside, especially stores, smaller spaces, that mask goes up. Doesn't hurt anyone, so might as well do it, right?
Nope.
So let's talk about getting these kids. Yeah, that's true too. Yeah, at this point, it's sort of like second nature. Let's talk about getting these kids vaccinated. Pfizer says that it will seek emergency use authorization for its vaccine for kids between the ages of 5 and 11. They're hoping by the fall that will happen, of course, in time for school. What's your take? Should kids who are heading to school be vaccinated? We've been told for the last year and a half that kids really don't get all that sick when it comes to COVID.
Yes, so it's a little confusing. I know people are always wondering, what's the right answer and who do I believe and what's the truth? So yes, it is true that children in general tend to not get COVID as much as adults, which is why schools tended to be able to be open despite kids not being vaccinated. That being said, they can still catch it and they can still spread it. So the chances of them catching it is less than an adult, but that doesn't mean it's zero. So yes, I personally believe that children should be vaccinated, and especially if they're going to school with large volumes of people in one small area. Look, we want to get back to the world as we used to know it, and the best way to do that is through vaccination. So I think, again, it's a multifactorial approach. It can't just be all about vaccines. We have to still use our preventative measures, like we're just talking about masks, treatment options, like we've talked about in the past with monoclonal antibodies and things like that. And then, of course, the arm of vaccination, which is you come at it from a multi-step approach. And I think, yes, kids should get vaccinated if they're going to school by all means.
Okay, so of the children who were infected with COVID-19, we started to notice this rare but serious multisystem inflammatory syndrome. It didn't pop up a lot, but it did happen. So there's a new study out of Washington, D.C. that found that both Black and Latino kids were disproportionately affected by this. Can you explain why that might be?
Yeah, so you got to be careful with the interpretation on that study. It was first of all, MISC, which is, as you said, multisystem inflammatory syndrome in children, affects primarily kids people less than 21 years old, and it's marked by just massive inflammatory processes across multiple organ systems, including your brain, your lungs, your kidneys, your heart, your gastrointestinal organs. And this particular study really, it was only in 63 children, and it was only at one institution. And that institution, DC Children's, DC National in DC, is a fantastic institution. But if you look at the population that it serves, it's primarily Black and Latino. So the question is this some sort of bias that already occurred because of the people that seek care there? This wasn't done at multiple facilities across the country. It was just looking at one site with just very, very few people that were looked at in this study. So I would be careful drawing conclusions from that. That being said, we do know that this particular ailment really has more to do with the individual than the virus. By that, I mean, it's basically determined by your particular response that your body has to the infection rather than the infection itself. So certain people will mount a massive inflammatory response to this virus. We know the virus is pro-inflammatory. It causes inflammation in everybody, but not everybody gets MIS or MISC in kids. So some people, for whatever reason, tend to get that. Now, whether that happens to be true, that it's more in Blacks and Latinos, we just don't know, because this was only done in 63 kids looking retrospectively, and it was in an area where that population tends to be overrepresented. So I would just be careful drawing conclusions about that with just this one study.
Yeah, that's really good information. I mean, I always say that context really makes the difference when you're looking at statistics and numbers, and you're providing that for us. Dr. Ron Elfenbein, thank you very much.
Thank you. Have a good day, Anna Marie.